as Eva mentioned, I'm a political scientist and work on social and health policies quite broadly. And so I will bring I'll give you first a quick overview of what I try to do when I compare social and health policies as a political scientist, and looking at the policy process, and then bring in a discussion of two recent research projects that I've been involved in as an example. I was actually asked to come up with a definition of global health. I think the other speakers were as well. So I resorted to using definitions I found most helpful from others, one from the Lancet and one from the Consortium of Universities for Global Health, that both get at the issue of global health as an interdisciplinary field of study. So within and beyond the health sciences, research and practice that places a priority on achieving equity in health for all people on a global level, and so with an especial emphasis on transnational health issues. And I like the quote above that discusses the synthesis of population-based prevention with individual clinical care. So moving on from that, I will go and, sorry, let me just move a little bit so I can see the screen completely. So comparative health and social policy. So the topic I gave you, which is pretty broad. What I'll first try and do is explain what I try and do. And I'm a political scientist, but I'm also at the interstices of public policies, and I try to look at policy processes. I've moved away. I've tried in the last 10 years of my career to focus not just on academic work, but also kind of more policy relevant work. Sometimes in especially political science, we can go through to this academic rabbit hole where we're speaking to very small groups of people on intricate theories explaining policy determinants. And I've tried very hard to bridge this and look at issues that have real world policy relevance. And so I focus a lot on trying to do basically measure government health and social policies comparatively, so globally, like across countries, to assess basically how well they do on health and social policies, and then broadly try to explain some of the determinants of under what conditions do governments produce more equity enhancing, effective and efficient social policies. That's basically what's driven my research over the last 30 years. So first, just to give you a sense, because I assume very few of you are actual political scientists, what I try to do first is measure government policies to answer the question, how are governments doing, and what drives it? You have to be able to measure what are governments doing. And so if we look at social and health policies, what I try and do is estimate a specific need in society. That sounds very familiar for those of you in the health sciences, whether it's, for example, access to reproductive health for women, child poverty, infant mortality, and then try to measure government response at scale to this specific need in a society. And then, of course, the question is, well, how do you measure government response? And one way is to just look at what are the best practices based on empirical evidence that we know, like what reduces, for example, child poverty, or maybe less controversially, what enhances access to universal healthcare for like maternal infant healthcare. And then secondly, what I try to do here in political science, we spend a lot of time comparing laws and expressed commitments. And what I'm especially interested in is how do we actually deliver policies to people on the ground? So policy outputs. And here, hence the title of the talk, kind of how to move from expressed commitments. Every government usually says, we care very much about child poverty. Every child has a future. We all want to help children. The most ratified UN convention in the world is the rights of the child. The second most ratified is the Convention on Eliminating All Forms of Discrimination Against Women. Yet when we look at the world, there's a whole lot of variation in actual policy outputs when it comes to children and women. And then thirdly, perhaps the most challenging of all is to come up with measurements of need and response that you can with which you can compare policy efforts across countries. And then secondly, once one has done that, then the challenge is to explain what drives the differences in government responses across countries or also over time. So you can look at it cross-sectionally or longitudinally. And here, what I do is I co-author quantitative research, but mostly the policy process analysis is qualitative. And the level of analysis is countries as units. Often those the measuring policies requires a lot of groundwork, and so it's kind of intensive, and you end up doing it in depth for a smaller number of countries. So you don't have enough countries to do statistical analyses on, and so you end up comparing countries. Now I've applied for a grant that would include the whole universe of countries, so 200 some countries. If I get that, then I can do more statistical analysis. But basically what I often do is the comparative method, which basically uses a scientific method to try to isolate causal effects by comparing countries by sort of very careful case selection, so that you can control for certain variables and then kind of hone in on the variables of interest that you have. But yeah, for example, it's very different kind of research than implementing RCTs and experimental designs. And the real world is not a lab, and so you kind of have to deal with what you have, and you engage in observational research. And through that comparative method, then you can test alternative hypotheses of what drives more equity enhancing policies around the world. So I'm now going to move on to discussing two specific research projects on social and health policies. The first is already completed, and that is looking at social protections for children during the COVID-19 pandemic. And the second one that is still ongoing is policies for women survivors of domestic and sexual violence. So moving to the first, and this is, I feel like it's kind of going, there was so much talk about the corona pandemic, and then when it was over, everybody kind of breathed a sigh of relief, and we don't talk about it much anymore. But going back to 5 years ago, when COVID-19 hit, it was a double challenge in terms of government health and social policies, right? On the one hand, you had the epidemiological challenge of how to get people to shelter at home to prevent the spread of this infectious disease. And then secondly, the social challenge, which was while people sheltered at home, how to ensure that their basic necessities was covered. And this was, of course, particularly acute in poor countries and among lower income families that didn't have these kinds of basic social safety nets or savings to carry them through. And especially crucial here, children come in, because while they weren't most at risk for the effects of COVID-19, they were most at risk in terms of having their basic needs not covered and going hungry. And that, of course, has huge implications for their long-term healthy development. And here is a picture that kind of summarizes this dilemma of a woman who's holding a sign protesting in the central square of Mexico City saying, "I'm dying of hunger, not the coronavirus." So this research project that I did focused on Latin America, which indeed is my area of research. And it ended up in Latin America was an interesting case to look at this issue, because it was basically a perfect storm for the spread of the coronavirus, with high levels of urbanization. So it's kind of controlling the spread of an infectious disease was a challenge. Half of the labor force is informal, so it's harder to reach them. And then you also have a high concentration of poverty in children. In mid-March, when all of this started, if you guys remember, 5 years ago, first Europe went into lockdown, Latin America saw what was going on, and they actually acted pretty fast and proactively. And my colleague with whom I work a lot, Fernando Filgueira, he's a director of the UNFPA in Uruguay, and he works with governments. He called me and said, we need to immediately write a policy paper on how they're saying they're going to have lockdowns, how this is going to affect child poverty. Like, we need to make sure they pay enough attention to that issue. And so we wrote a policy paper that was published on the 1st of April, like right at the moment that things kind of got really bad. Calling for this, and then the UN asked us to write a broader paper and to write like an analysis of social policies in real time. So what we did is we started collecting data on 10 Latin American countries. The case selection was democratic with minimum level of reporting and state capacity. We were doing it as a desk job, so we're entirely reliant on online sources. And we selected the cases that we looked at like right at the beginning of the pandemic. So we had no idea what they would actually do. And then we published it 6 months later as a UN doc with actually some German funding. So what we did here, it was interesting because right at the beginning of the pandemic, also all the governments did say, we are going to take care of everybody who's poor, we're going to have lockdowns, but we're going to help you. So the expressed commitments were there. At the same time, the UN was publishing all these trackers saying all the countries publishing like a certain number of, like, Argentina just passed 10 policies, Brazil passed 3 policies. They were counting policies. And we thought that's not an effective way of knowing how to measure policy effort. So what we did was we looked specifically, we created standardized indicators related to coverage. And so cash transfer coverage, which is an established policy and is kind of the best protective mechanism to ensure people's basic necessities are met, geared towards children, half of the children in the region live in poverty, and then towards informal households in the form of new emergency cash transfers. Then we measured coverage related to the universe of children and the universe of informally employed people, and adequacy we measured as the adequacy in relation to each country's national urban extreme poverty line. This, in a sense, is what we got. This shows coverage. This is just an idea of the kind of work one does. What this interestingly shows that this, on the left-hand side, you have the coverage and cash transfer programs. You don't see major increases here. Where you see massive increases is in the creation of new programs to people and households that were in no social protection system beforehand, which is about 1/3 of the population at least. Here you also see massive variation. So the red line is need. This reflects the informal employed population. The formally employed population have other programs. We don't need to kind of be concerned about them. But here you see the informally employed population. You see massive variation across the countries. And what's quite interesting, actually, going back to the issue of expressed commitments, the 2 countries where the presidents were perhaps most vocal in talking about how much they care about the poor were the 2 lowest performing countries, Colombia and Mexico. So maybe there's an inverse relation between expressed commitments and actual policy action. Here we measure adequacy. The red line is the extreme poverty line. There's a ton of detail here. This is just as a measure of like how we tried to get at it. It was very detailed, kind of boring death by detail, but I feel we captured actual policy effort in doing so. And also just to highlight, this had meaningful real life consequences for health. So for example, one of the top performers of Brazil, 4 months into the pandemic, given the massive emergency cash transfer programs, Brazil reported as the lowest level of extreme poverty had ever had in its history, because it actually improved extreme poverty rate at the bottom, versus Mexico, the worst performer. 6 months into the pandemic, a UN survey found that 80% of children were not meeting their nutritional needs. So then, the second part was, so this is basically, we summarized it into this table showing the variation from strong to no response. And here, the second part is the determinants factor. What we found very interesting was that some of the factors we would assume would explain this massive variation didn't. Need didn't, so it's not that they just functionally responded to the poor. That's not surprising from a political science perspective, it rarely is. More interestingly, left-right ideology didn't. The top performers were governed by right-wing governments, and the worst performer was a self-declared left-wing pro-poor president. Then we go through some other usual suspects. In the interest of time, I will kind of go through them. I can get, if you have Q&A, I'm happy to discuss that. None of these explain the difference. And this was actually an inductive project, but what did, and this is counterintuitive, and I think it's quite interesting. Well, Policy legacy is intuitive. The stronger the cash transfer program going into the pandemic, the more likely, it wasn't at least going to be withdrawn. Okay. What's more interesting is that the countries that performed most strongly had divided governments. And we process traced this, and we found this political game of credit claiming versus blame avoidance that happened with divided government. And when you had divided government, you got into this like a political game of trying to one up the other that led to more expansive policy responses. And that was quite counterintuitive. Okay, moving very quickly, and I only have a few slides on the second project that I wanted to discuss, which is violence against women. It's part of the Lancet Commission on Violence Against Women and Children. I'm heading and coordinating the policy section. Without further ado, we all know it's a big problem. 1/3 of women have experienced it. About 10% of ever partnered women in reproductive age suffer physical or sexual violence from their partner in the past 12 months. It has serious health consequences and serious economic consequences. My question was, where are governments at? Here we see truly massive expressed commitments. Almost all countries have said, it's wrong. The UN has declared this one of its SDG goals. WHO has a global strategy to address it. And over 80% of countries have passed laws on domestic violence and multi-sectoral national action plans. We also know how to help survivors. We know what the evidence is on best practices. And here, this is healthcare. They need mental and psychological health services, but it's intersectoral. They also need socioeconomic assistance, police protection, and legal services. It can be delivered in a variety of ways. The most important thing is that they're delivered in a trauma-sensitive ways and are coordinated, whether it's through specialized services or through existing health and social services. What we know very little about is how many women suffering violence are actually reached by public services. And this is what we set out to do with a team with virtually no funding, but we managed to do it. We looked at 8 countries and created, and this was really difficult, a comparative at-scale measurements of government recognition of survivor need. Need measured as past 12-month experience of physical and/or sexual intimate partner violence. And recognition, administrative data on violence against women help seeking from state agencies. And will be submitted soon for review, but is not yet. And so please, it's preliminary figure, please don't circulate it. But this gives you an indication of what we have found. And what's interesting is that across the board, there's no government we have found that meets even 1/3 of the need. And our measure of need is conservative, okay? Spain comes as the forerunner, where state agencies, like lots of women, turn for formal help seeking to state agencies that recognize it and provide intersectoral services. Then we go to the other end, where we have, for example, India, where less than 1% of need is actually recognized by the government. And the idea here is that this is some kind of a standardized comparative way to sort of tap into, are any of these expressed commitments actually reaching women who desperately need these services? And of course, the causes here are very complex. This is just, there's all sorts of stuff going on here, but this is just a comparative way to try to tap into that need. And then from here, we're working on categorizing this recognition, and there are some preliminary consequences related to some of the drivers of stronger government responses. There's all sorts of literature on there is enough literature on what makes women formally seek help and et cetera, but we have what we're trying to do here is look at some of the policy drivers of having a stronger response, and they have to do with state capacity and a legal network, a legal framework that prohibits violence to an extent unnecessary, but not a sufficient cause for a stronger response. And here, beyond this, it gets into a story about the politics of women's advocacy and the importance of women's movements. This is an issue that has been brought to the political agenda almost exclusively initially by women's movements, and then the role of women's state agencies within the government. Very briefly, what is the relevance of this work? I think there's an important job here to try to contrast expressed commitments on what governments actually do to hold them accountable. And then secondly is that politics matters, which, I think we can probably agree on, but what's interesting is how does it matter? And that has policy implications. So, for example, from the first part of the social protection story, it's a story of, and this sounds, and it is quite obvious, is that if you want governments to do things that you think are good for people, you need to make sure that they can take credit for it because they want to look good and they want to be reelected. And so how do you frame issues? Like as an advocate, how do you frame issues to get the interest of policymakers? I'm going to stop there. I hope I didn't go too much over time, cram too much into a short presentation.